Loneliness, defined as the subjective feeling of social isolation or dissatisfaction with one's social relationships, has been the subject of extensive research. There have been numerous studies conducted that have shown a link between loneliness and adverse effects on health. Loneliness is associated with increased risks of various physical and mental health problems. One prominent study that gained attention was conducted by researchers from Brigham Young University. The study was published in 2015 in the journal Perspectives on Psychological Science. The researchers conducted a meta-analysis, which involved analyzing data from 148 studies involving more than 300,000 participants. The meta-analysis examined the relationship between social isolation, loneliness, and mortality. The findings of the study revealed that loneliness and social isolation were associated with a higher risk of mortality. The increased risk was comparable to the risks posed by other well-established health factors like obesity and smoking. In other words, individuals experiencing loneliness and social isolation were found to be more likely to die prematurely than those with stronger social connections. Cardiovascular issues. Loneliness has been associated with higher blood pressure, increased risk of heart disease, and higher levels of stress hormones, all of which can contribute to cardiovascular problems. Immune system functioning. Prolonged loneliness has been linked to changes in immune system function, potentially leading to a compromised ability to fight off infections and diseases. Mental health disorders. Loneliness is closely tied to mental health issues such as depression, anxiety, and increased risk of developing other mental disorders. Cognitive decline. Some studies suggest that chronic loneliness might be associated with cognitive decline and an increased risk of conditions like Alzheimer's disease. Overall mortality. As mentioned earlier, several studies have found an increased risk of premature death among lonely individuals, comparable to the risks associated with smoking and obesity. It's important to recognize that loneliness is a complex and multifaceted issue influenced by various factors such as social support, individual personality traits, and life circumstances. Addressing loneliness and fostering strong social connections can play a vital role in promoting overall well-being and maintaining good health.